Great. So, welcome everyone, and thank you for joining us tonight or today afternoon for you, Dr. Daniel Chong. I'm super happy to have you here. It's a real pleasure to introduce you first with a couple of words so the audience knows a little bit more with whom we're going to speak tonight. You are a naturopathic physician based in Portland, Oregon, and you earned your doctorate in naturopathic medicine from the National University of Natural Medicine and have been practicing since the year 2000. Your clinical focus is on advanced risk assessment, prevention, and treatment of arteriosclerotic cardiovascular disease and related condition. In addition to your degree, you pursued specialized training in cardiometabolic medicine with Dr. Mark Houston and completed a Beldonin method preceptorship and work as well for 4 years as a clinical consultant for Boston Heart Diagnostic. Dr. Chong, welcome here in my Zoom room with my clients, and some of my American friends should show up as well. I'm truly excited to have you here to talk about one of the hottest and most misunderstood topics in health. I must say it's quite a happy draw that we had, because we planned an interview in February and it couldn't take place. And then there has been such a great study that came out a couple of days ago. And I think it's just perfect that we have our interview now, because we're just going to jump on the subject. I've already collected many interesting questions in advance, and I will begin with those. And afterwards, we'll open the floor for live questions. So if you have questions, you can write them in the chat box, so I can pick them then at the end of the interview. And of course, you will be also able to switch your mics on after the interview to ask your question. So just quickly, the last part in German. Ihr könnt eure Fragen am besten im Chat schreiben, so kann ich die dann aufnehmen nach dem Interview, oder ihr könnt euch natürlich nach dem Interview auch freischalten, wenn wir dann mit den Fragen fertig sind und ihr das Gefühl habt, es fehlt noch was. Okay, so we are ready to go with the first question. Could you please explain us in very simple words what are good and bad cholesterol?
Sure. I would say there's no such thing as good and bad cholesterol.
Oh.
Can you hear me?
Yes. Now you were frozen for a couple of seconds, but now it's okay.
Okay. I was just saying, I would say that technically there's no such thing as good and bad cholesterol. Cholesterol is a normal, necessary substance in your body. As I'm sure many people have already heard, you can't live without it. It's involved in a number of different processes and building your cells and different things like that. So the cholesterol in and of itself is not good or bad. It's just a necessary substance. And then the common misconception around that whole idea that there's good and bad cholesterol is based on the idea that HDL, which is a particle that has many different roles, but in the realm of cardiovascular disease, it is known to help reduce risk for different reasons. That's why it's considered good. And then LDL is a counterpart type of protein that carries cholesterol around, that because of various processes that I'm sure we'll get into, it can directly contribute or be a causal component of the process of plaque developing in your arteries. But it's not the nature of the molecule itself being bad that makes that happen. It's other conditions that have to be at play in order for that to happen. So, you'll probably get tired of my level of nuance that I get into these days in all of this as I continue to learn more and more. But yeah, it's really, in general, it's quote unquote bad because it's the one that's involved most commonly in the issue, but it's technically not bad. It's like a good thing getting into a bad place. How about that?
Yeah, that I love it. And I think
Yeah.
it's very, very important to be nuanced by the things because it's nothing black or white, especially in this area. And I think it's very important. We hopefully can bring some light in the dark tonight.
Yeah, do our best.
Can you tell us how much of our cholesterol levels are influenced by diet and lifestyle, and how much is genetic?
Sure. I'll just, when we talk about cholesterol, I just always make the point of clarifying that we're talking specifically usually about LDL related levels. And in terms of what you just asked, it can be vastly different from person to person. So some people can have dramatic effects on their LDL levels through their diet, whereas other people seem to be able to try various different approaches with diet and it doesn't really affect their LDL levels at all because there's other processes that are impacting that. So in general, it's well recognized that higher intakes of saturated fat can lead to increased levels of LDL specifically because it affects how well they get cleared out of your bloodstream. But even that doesn't happen to the same degree in each person. So um, when you're speaking very generally, processed food, junk food, high saturated fat diets can frequently increase it, but not in everybody. And then switching to more whole foods, vegetable based diets, etc., high fiber diets can reduce it to some degree, but that doesn't always happen in everybody. So it's a bit of a individual thing in terms of how people are impacted, and there's a wide variety of different potential genetic mutations and things like that can impact this process as well. Sometimes very mildly, sometimes extremely. So that also depends on the person.
But from your experience, you've had the past years you've worked with your patient. Can you say approximately how many percent of your patient were able to drive their levels down with the right lifestyle?
Yeah, I would say it's much more than 50%. Like I would say the majority of people can at least get their levels down to some degree if they start making specific efforts with certain angles of their diet. Um, that said, again, there's a small percentage of people who I see drastic reductions in. It's like they're honing in on the exact perfect diet for their body, and it really changes things dramatically. And then again, other people there's like no change at all. But on average, most people seem to be able to lower it at least to some degree. And then I would also just add that brings up another question as to sort of like who is the person and what's going on with their body. And so, in other words, sometimes if somebody has a really severe situation going on, even if their levels go down quite a bit with diet, it may not be in their case low enough to expect a full halting of the process of plaque developing in their bodies, but it's always going to help at least to some degree.
Yeah. So speaking of the values or the blood values, and depending on which people, I guess also someone who already had a heart attack or not, or someone with a familiar hypercholesterolemia, for example. Could you give us some ideas what should be the blood values for LDL, and is LDL the value we have to focus our attention on?
Yeah, so we could probably talk the rest of the hour about this one question. Um, in general, the way that I think about it is there's kind of three tiers of ways to check this angle of risk. So this LDL related angle of risk. The most classic test is an LDL-C or LDL cholesterol level. Um, Technically, that is an estimation of how many actual LDL particles are floating around. And then there's an LDL particle count where you can actually count the actual amount of particles and you're not just estimating it. And then there's something called an apolipoprotein B, which you might have other questions about later. That is technically a protein that's present on LDL, as well as other molecules that can also cause a plaque to form or contribute to plaque forming. So it's considered by most experts now to be sort of the best way of assessing risk from that angle, the apolipoprotein B or ApoB. And so in terms of actual levels that are considered optimal or whatever, even that depends on the person. So if you have somebody who has no strong risk factors, no strong family history, they don't have any other health conditions going on that might exacerbate or worsen the problem. They're just sort of a general healthy person trying to be well and stay well. In the realm of LDL, usually at or a little under 100 milligrams per deciliter is considered sort of optimal. Whereas if that person has higher risk factors, they're older, they have high blood pressure, or they have diabetes, or they have a strong family history of cardiovascular disease, then typically the considered optimal levels drop down to below 80. However, if somebody has had an event, they've had a heart attack, or they've had an imaging study that shows that they have plaque already present in their system, so in other words, there's kind of like a fire already burning, so to speak, then typically you're going to get more aggressive with that. And there's the latest guidelines for LDL-C are suggesting those people get their levels down below 55, which is very, very I almost never see somebody get that low through diet alone. And then that being said, I do think it's important to consider that all of the research studies that are supporting those levels, those recommended levels, are done typically using drugs as an intervention, so lipid lowering or cholesterol lowering drugs as an intervention. And they're not being done on people who are simultaneously eating a really healthy diet. And so, in my opinion, at least, it's hard to say definitively that somebody who's eating really well also has to be quite that aggressive to get the desired result of plaque reduction or stop, halting progression of plaque, because the whole process is multifaceted, and LDL related molecules are just one part of it. So when you're eating a really healthy diet, you're working on other different angles that are also going to be at play. So point is, if it's sort of a standard American person eating a standard American diet and they're just trying to control their disease, I'm going to be more likely to utilize those recommended levels of cutoff. But if they're eating really well, then not necessarily that aggressive. Hopefully that makes sense.
Okay, I lost you. I don't know if it's my problem. Maybe someone can tell me just the last sentence, but maybe it's just on my side. So, Alexander, hast du alles gehört?
Ich habe soweit gehört. Er war, glaube ich, fertig und hat dann Pause gemacht.
Okay. Then it's just on my side. All good. Okay, great. So, yeah.
Just raise your hand. If I freeze, just raise your hand.
Okay. So, yeah, just coming back onto what you said about different factors that play a role. I guess there is also something with the inflammation in the body, the systemic inflammation, that maybe people who eat standard American diet have much more than people who eat a well-balanced plant-based diet.
Yeah.
So how is the inflammation in the body important in that process?
Yeah, it's very important. I mean, I like to think of it like kind of as you described it, like the environment in their body and whether or not it's more or less conducive to the problem beginning. And so having higher levels of systemic inflammation is a known and recognized what I would call exacerbating factor or worsening factor. So it helps set the stage for a higher likelihood of plaque developing through the same process of these molecules getting into the artery lining and that type of thing that maybe we'll go into later. But so systemic inflammation and high levels of oxidative stress, which are both going to be potentially quite common in somebody who's eating an unhealthy diet in general, and more so in some people for various reasons. But the general state in the person's body when they're eating a poor diet and the higher tendency to inflammation, higher tendency to oxidative stress, sort of just literally is like a multiplying factor. So it just, all the technical things that go into a plaque actually forming are all worsened and encouraged, so to speak, by a higher inflammation, higher oxidative stress environment.
Great, thank you. So there is a big controversy like for years, but it's been a little bit stronger these last couple of weeks or at least days because there has been a new study coming out saying that LDL and cholesterol level have no impact on plaque formation. So could you just maybe say a couple of words about this?
Yeah, so I mean, I assume you're talking about the study from the keto CTA study.
Yeah.
So there's a lot of different angles that you can come at commenting on this study. Most specifically, at least from my opinion, which is based on listening, learning, and observing commentary by really the world's leading experts in lipidology, et cetera, and their assessment of those results. The study itself was not very well designed, and technically it was not. This gets a little technical, but it's important to understand. Like this was not what you'd call an interventional trial where they take one group of people and they put them on a diet, and they take another control group and they don't put them on the diet, and they watch exactly to see how the different effects happen. This was just an observational trial with a group of people that were all in the same category. They all had extremely high LDL levels, and they were just observed. They were looked at imaging studies of their arteries at baseline, and then 1 year later to see what happens. And in doing so, most assessments of the study itself have stated that they made very inappropriate conclusions. Really, you couldn't even make any single conclusion from the study because there was no actual intervention. It was just an observation. So the most that you could technically say is, that's interesting. Some people with really high LDL levels didn't get as much plaque progression as we might have expected. That's all you can say. Whereas the interpretation that you hear of the study in social media, even on Fox News, et cetera, is more like, see, LDL doesn't cause plaque to grow, or it's unrelated, or whatever. And even some of the authors, unfortunately, have gone on podcast interviews and things like that and stated it that way as well. Which is literally like an inaccurate assessment of the results. So it's an interesting study that I think needs a lot more, fleshing out of, so to speak. But the other thing that's very important to point out that the authors did not acknowledge initially at all is that one of the ways that they were evaluating people in the study is looking specifically at the change in the amount of what you'd call non-calcified plaque in their arteries, which is the more concerning active part of the plaque. And when they looked specifically at that was initially the thing that they were supposed to be evaluating. But when they wrote the paper, they didn't include that figure. They looked at something else that was unrelated to that to some degree and didn't look the same. But when you look at, they were kind of essentially forced to reveal the data on that particular thing, how much non-calcified plaque change was there. And when you looked at that, the change in 1 year on average in their group was one of the highest amounts of increase that's ever been seen in any study. And that includes people who are much less healthy than on average in terms of diabetes, high blood pressure, etc. These people in this group had none of those things. They just had very high LDL. And yet, on average, their non-calcified plaque increased much more than is typically seen. So even though you still can't make a conclusion about that, you can still say, wow, that's concerning, like, and yet the general consensus amongst the authors was based on information that they weren't even talking about that. They were just saying, like, basically we had high LDL levels and it didn't seem to correlate with how much plaque progression happened. And yet they kind of ignored the fact that many people in the study had tremendous plaque progression. So it's hopefully you can tell it's a very complicated situation. There's a lot of controversy around it. There's more than I've even talked about that really paint it. Many scientists are calling for it to be retracted because it's such a bad study. But I think I'll just stop there because I could keep going on. But that's my general take on it. I'm happy to talk about some, related topics around that. But that's in terms of the study itself. That's been my interpretation.
Yeah, absolutely. Thank you. Yeah, because from this study and from everything that goes out in the Facebook and internet world, lots of question comes to my ear, like, well, then can we eat eggs again, or can we eat meat again, or what happens with all this? Because there are lots of cardiologists as well, well-known, established cardiologists who state that a high-fat diet is healthy for the heart. So how can that happen with the weight of the studies we have proving the contrary?
Yeah, I mean, I'll just say, like, a lot of the let's just put it this way. Nutritional studies are they're very difficult to be able to make definitive conclusions from. So if we're talking about, for example, does butter cause cardiovascular disease? Technically, that's a really hard question to definitively answer. So depending on how you design a study or depending on how you interpret study data, you can come away saying fairly different things, depending on the person and what their motivation is, et cetera. And I would certainly acknowledge that not all the studies, as an example, on butter showed negative effects. But just as an example, many of the studies that are done are with butter, for example, that suggest it doesn't have a negative effect, are oftentimes done where they take people who are eating either a very poor quality, high refined carbohydrate kind of junk food diet and remove some of their, have one group of people eat that, and then another group of people remove some of those calories and put butter in instead. And then they say, look, there's no difference in health outcomes when you add butter. And yet what you're really saying is, if you eat butter, you're just as unhealthy as if you eat other unhealthy food. So there's a lot of studies that are kind of designed that way, some of which are designed by the dairy industry or funded by the dairy industry, et cetera, that really help muddy the waters and make it very unclear. And then you can look at a group of those studies and say, see, look, there's really no connection. We can't really say that that's a problem or not. And yet, if I take a patient and I have them eat a low-fat, whole food, plant-based diet, and I look at their LDL levels and their inflammation levels, et cetera, and then I just have them add 3 tablespoons of butter to their daily diet on top of that, you're going to see a significant difference in everybody. And so it really depends a lot on how you look at things. So, some of these doctors and experts out there who are saying these things, I've really, really done my best to look into what they're basing their opinions on. And every time it's a similar story. And so it's really, the most you can say is like, maybe, but it's mostly just because the waters are muddy by all these junky studies. So, the bottom line to me is always my patient and what happens in their own body and what happens when they're doing whatever they're doing. And time again, when I look at things from that perspective, there's a clear difference between, a lower fat, high quality plant-based diet and eating saturated fat in higher amounts.
Yeah, thank you for this clarity. You talked about ApoB and apolipoprotein A as well, or I talk about this now. For someone who hasn't had a heart attack and has no family history of heart attack in his family, if this person can bring his LDL down under 100 or 80, with lifestyle, is there any interest of measuring ApoA and ApoB still?
I want to make sure you're talking about ApoA, not lipoprotein little a.
Yeah.
Okay. So essentially you're talking about, apolipoprotein A1 is a protein that's found on the surface of HDL molecules, and it's essentially kind of like probably a bit of a better way of counting or assessing the impact from HDL related molecules. And so what I think you're asking is, if you have pretty good control of your LDL ApoB levels, is it still important to check ApoA1? Is that right?
Yeah.
Okay. What I would say in general is that most research suggests it's unnecessary, especially if you're checking ApoB, because there's been multiple studies where they look at ApoB or ApoA1 and the impacts of that on risk, but then if they account for what the person's ApoB levels are, that usually helps just sort of clear that up, and it usually ends up being more related to ApoB more than anything else. That being said, I think if you're looking specifically at the ratio of either HDL or ApoA1 to triglycerides, that does give some information about what you call metabolic health in people. So how good of a job they're doing at trafficking and processing their fuels that they consume, carbohydrates, etc. So long story short, you see a strong connection between people who have poor metabolic health, so poor insulin sensitivity, higher tendency to blood sugar problems, etc., and a skewed ratio between HDL or ApoA1 and triglycerides. So the higher the triglycerides, the lower the HDL that you see, the stronger the suggestion is that there's some problems with metabolic health. So I look at it more as an indirect way of assessing, or one indirect way of assessing metabolic health, which is a very important additional factor in cardiovascular disease outside of LDL and ApoB related markers. So hopefully I'm answering your question. I do find it useful, but it doesn't, I'm never going to see a really high ApoB, but because somebody has a high ApoA1, then I don't care about it. A really high ApoB always sort of trumps everything to me in terms of risk from that angle. Hopefully that makes sense.
Yeah, absolutely. So can you tell us a little bit more about this ApoB? What is the role of ApoB in plaque formation?
Yeah, so essentially, like, if we just sort of step back and think about the general term lipoproteins, LDL is the most common type of lipoprotein, which is basically a cargo ship for carrying cholesterol and other fats around in the body, really more other fats. There's other types of lipoproteins, in particular VLDL and lipoprotein A, that also fit into the general category of lipoproteins that are also trafficking these things around to some degree. ApoB, just think of ApoB as like the scaffolding or the structure. It's like a protein that these lipoproteins are built from. So it's like this very important scaffolding that everything else is built off of. And the reason why it's so important is it's only found on molecules that are the ones that can cause problems. So HDL, for example, does not have apolipoprotein B molecules on it. Only molecules that can get into the artery lining and get stuck in there and start the problem have ApoB on them. And so technically ApoB is what, if the LDL, as an example, gets into the artery lining and gets stuck in there, what's actually getting stuck is the ApoB is getting stuck to something in there. So I look at it in more general terms as a better way of counting all of the molecules that might cause a problem. And then from within that group of molecules, LDL is the one that's present in the highest levels by far. So it's a better proxy for risk from that angle.
Okay, great. Thank you for the clarification on this point. What role, because you mentioned triglyceride as well, what role do play triglyceride in plaque formation and heart health?
Yeah, so the way you want to think about it is the triglycerides are just fat that's typically coming from the diet. So you eat food that has fat in it, you absorb some of it, and that gets shuttled around for fuel to the muscles, to the heart, etc. So triglycerides themselves are not understood to be inherently problematic. Like, they don't actually cause the problem. The reason why they're so strongly correlated with risk is that when you see high triglyceride levels, that is usually due to poor metabolic health and a disruption in how these lipids are trafficked around in the body and exchanged with each other, etc. And so it's more a high triglyceride level. Just think about it as a way of, and we're talking specifically fasting triglyceride levels, as a way of sort of like a rough way of identifying poor metabolic health, poor insulin sensitivity, excess sugar in the system, that type of thing. But in and of itself, it's not like a harmful molecule.
Okay, so I was gonna ask the question you partly answered, because my audience may not know what is poor metabolic health, so what is hidden behind this term?
Yeah, so generally, metabolic health is like technically termed sort of like if somebody has good metabolic health, they are doing a good job of taking in energy through food and dispersing it and delivering it and utilizing it in their body. So it's not one specific thing. It's that whole, that's like an umbrella term for metabolic health. So when people have poor metabolic health, or they have what's called metabolic syndrome, it's a grouping of different things that appear to happen with people when they're not doing a good job there. They tend to get high blood pressure. They tend to get high triglycerides and low HDL. They tend to be overweight, oftentimes but not always. So these are some of the things that sort of grouped together would be under this term metabolic syndrome, which is a known exacerbating or worsening factor to the development of cardiovascular disease.
Okay, great. So is it possible to have a high triglyceride while being on a low-fat plant-based diet if the person eat a lot of fruit and dried fruit?
Yeah, absolutely. You're usually not going to see it go like really, really high, but you can see it go high enough that for me, if I see that in a patient, I would ask them, how much carbohydrate, especially concentrated carbohydrate sources, are you eating, number one, and number two, how much exercise are you doing? Mm-hmm. So you could really think of it, especially somebody eating that way, as sort of a marker for usage of carbohydrates versus like consumption of carbohydrates versus burning of fuel through activity, exercise, things like that. So usually if I see it higher than optimal, the person may be, as you just noted, eating a lot of fruit, especially dried fruit, and or not exercising very much. And so if we usually tweak that around a little bit, you'll see an improvement. Sometimes people have more problems going on that there's some aspect of dysfunction going on that's contributing, but usually it's more just related to those two things.
Okay, great. So you mentioned exercise. How important is exercise in lowering LDL values and triglyceride?
It's very important for lowering triglycerides. It doesn't tend to have as strong of an effect on LDL levels. So from when I look at exercise, I'm thinking about it more from the perspective of other things, other positive things that it's doing, helping improve the health of the artery lining, the health and function of the artery linings, improve the strength of the heart, burn fuel so there's not excessive amounts of fuel lying around and subsequent, fat deposition and things like that. So that's kind of more how I visualize the role of exercise. I don't usually use it as a tool for helping directly lower LDL.
Oh yeah, we often hear that HDL is the good cholesterol. How important is it to have a higher HDL if LDL is very low?
So very generally, this kind of goes back to sort of what I was talking about initially about the good and the bad, and that not really being an appropriate term. But another way to think about it is there's been lots of research into drugs that raise HDL. Because initially they thought, wow, HDL is so definitively important that for reducing risk that if we raise it, it's going to lower cardiovascular disease. So there was this big push to identify and create drugs to raise HDL with a strong expectation that it was going to help lower risk. And when they actually did those trials, they found that it didn't do anything. And in some cases, it was harmful to the people. So the entire industry just dropped that idea. And the basic idea is that HDL in and of itself is incredibly important. It's a very crucial molecule to helping reduce risk, but measuring it in your blood is not that good of a way to assess how well it's functioning in your body. So the long story short of it is that the level of HDL-C in your bloodstream doesn't really have any direct reflection of how well each individual molecule is working. So in other words, a simple analogy, if you think about like a neighborhood that has garbage all over the place, and I think in Germany you guys do a much better job of keeping the streets clean maybe than some cities in the United States, but anyways, just imagine if you could that there's garbage all over your streets and you're sending out garbage trucks to pick it up. And in one area of the city, you have garbage trucks that are extremely efficient. So efficient that they can pick up like 5 times the normal amount of garbage that a normal garbage truck could pick up. And then in another part of the city, you have garbage trucks that are a little old and broken down and don't do even a very good job at all. And yet the job is go pick up all the garbage. What you're going to end up seeing happen is one, in the first city, they send out just a few and they pick up all the garbage. And in the other city, they have to send out like 5 times as many garbage trucks to pick up the garbage. And so that second city might have higher HDL levels, higher garbage truck levels, but it doesn't mean that they're working very well. It just means that their body's having to kick out more to do the job. So high HDL does not always reflect protection. And that, in fact, there's some research that shows that people who have particularly high levels, so like over 80, 90 in women, over 65, 70 in men and higher, there's an increasing risk for cardiovascular disease in those people, at least some of them. And so it may very well be because those people have defective HDL and their body's just kicking out more to try to make up for that. So it's not, one of my main mentors in all of this literally doesn't even look at HDL anymore on a lab test unless he's trying to get a rough assessment using the triglycerides and HDL. Otherwise, he doesn't really pay it any attention. And I'll just say one other thing. Another way to think about it, for example, I'm sure you know Dr. Dean Ornish and his research. Yes. And his research showed regression in plaque using their approach, their diet and lifestyle changes. And all of those patients who had reductions in plaque on his program had reductions in their HDL levels along with it, and yet they had plaque shrink. So it's clearly not that directly related.
Right. Right. Yeah, I heard that also about not taking care much of HDL level, and I'm really happy you mentioned that as well because it um, um, goes in the same direction. So thank you.
Right.
What is your perspective on statin therapy for primary prevention?
There's much less really strong data showing that that's going to have a huge impact on the average person. Now, I always get more nuanced than that, so you could have two people who have no diagnosis of cardiovascular disease, but one has much stronger family history and other factors going on with them that are increasing their risk. And then the other person's healthy and does a great job and has no family history. If you give them both a statin because they both have high LDL, clearly you're gonna likely have a better outcome with the first person than the other person. So there's some nuance to it, but they're definitely, certainly in my practice, not the preferable primary tool or primary intervention for cardiovascular disease risk. I'm more, if and when I ever recommend them or prescribe them to people, it's more situational because there's a very bad situation going on and we're literally trying to just get a handle on it from every angle that we can. And in that case, I do think that there's a lot of potential benefit. You'll see people on the internet point to studies that show like, well, if we give people statins, it only extends their life by 4 years. 4 days, sorry. So what's the point? They'll say that type of thing, or it reduces risk of events by 1%. So what's the point? And one thing I think it's important to point out is that most of those studies are done very short term. And so what you see like a small benefit, but if you extrapolate that out for 15 to 20, 25 years, the benefit grows immensely. So you might see a study where it shows, are you familiar with NNT, number needed to treat? So that's another thing that's commonly brought up. People will say, well, this study over here showed that you have to give 200 people a statin prescription in order to help one person prevent a heart attack, which might be true in some groups of people, but in other groups of people who have serious problems going on, if you give them a statin, you might prevent a heart attack in 1 out of every 2 or 3 of those people. So it's very context dependent. And yet the thing that drives me crazy is that the people on social media who talk like this don't ever bring that context into, they just say, because this study showed you have to give it to 200 people to prevent a heart attack, statins are worthless, and that's just totally inappropriate because you don't really know who you're talking about. And somebody else might have a very different situation going on. So, I mean, as always, my baseline is always diet, lifestyle things as the foundation. And then we utilize tools as needed on top of that, depending on the situation.
Yeah, I agree. The way I understand this kind of study for me in a more nuanced way is basically not to make people believe that statins is the solution, the first solution, but as you said, first is lifestyle medicine and look at what history the patient has and what other problem he has, and then of course it's all very personal adaptation.
Yeah, and then on top of that, once you decide on whatever plan the person, or once a person decides whatever they're going to do, some combination of diet with or without medications or supplements or whatever, I always sort of say the most important thing is to then do your best to verify that whatever you've chosen to do is working, right? Don't just take the word of somebody on social media saying, oh, if you do this, you'll be fine. And so you do that and you don't ever check to see if your body's fine. You should always do your best to confirm as much as possible, yes, what I'm doing is actually enough. It's working. I don't need to do that other thing. But if you find out that your body's still getting worse in some ways, then maybe you do need more tools. in that situation.
Yeah, absolutely. We mentioned chronic inflammation playing an important role in plaque formation. What could be something that people could do to lower chronic inflammation?
Well, if we take out like health conditions that directly cause high inflammation, like autoimmune disease, rheumatoid arthritis, things like that, those things aside, in general, if we see somewhat elevated inflammation levels, it's oftentimes related to diet, and there's a lot of different potential reasons for that. It sometimes could be related to other things, and any type of immune challenge going on in the body may raise inflammation levels. So if somebody has a chronic infection going on that they don't know about, especially dental infections, for example, or their cells are stressed out by lack of oxygen because they have sleep apnea or something like that, you can get inflammation levels to come up from that. So the key always is, if you see higher inflammation levels, you want to do your very best to try to figure out why, versus, another thing that drives me crazy. Now I'll bash the natural health community for a moment. And when I see people say, oh, you have high inflammation levels, take turmeric and fish oil because those are anti-inflammatory. I'm always like, well, why, hold on, why is the inflammation there? We should be treating the reason, not just using a natural tool or a drug to just lower the inflammation. So there's a lot of different things, but in the realm of diet, at least what I've seen, and I've seen it over and over again, I've seen many people who are eating a really high quality diet, very clean, organic, lots of vegetables and fruits and things like that, but also eating a lot of animal food with higher inflammation levels than you would expect. And if they're willing to do so, they remove the animal food and their inflammation levels drop. My interpretation of that is that, even the high quality animal foods, from better sources and grass fed, etc., they still go through a processing, once they've been killed, and, they process them through the slaughterhouse and all that type of thing, where they get contamination and exposure to bacteria. And even if you then cook the food and kill the bacteria, there are toxins left over, we generally termed endotoxins, that are oftentimes found to be present in various types of animal food that you cannot avoid exposing yourself to if you consume those animal foods. And if they get into your bloodstream, they can cause an inflammatory response. So that's one potential explanation for why even people eating a quote unquote healthy diet can still have some inflammation levels, and why time and time again, when people go plant-based or either completely or mostly plant-based, I will usually see a drop in their inflammation levels just from that. But the point is, don't just assume it's only from diet. It might be from something else as well.
Yeah, right. Stress and sleep deprivation plays a very important role as well, right?
Absolutely, yeah.
Okay, thank you. What daily habits or practices do you personally follow to support your heart health?
I try to eat well, sleep well, exercise, keep my stress levels low, go outside into nature as much as possible, touch the earth. I'm not a huge supplement person. I take a multivitamin and magnesium for the most part, because I do try to just get anti-inflammatory stuff from the food that I eat versus a lot of these supplements, things like that. So those are the main things, nothing groundbreaking or very surprising, pretty basic stuff. But the general idea is just do the things that we know that human bodies seem to need to thrive. I just try to incorporate those as much as possible.
Great, great. And how much exercise would you suggest for someone who is maybe just starting on this area?
That's a great question. There's a lot of different opinions about that. My general view on that, and what I talk to my patients and clients about, is I try to instill in their brains the idea less about I got to get my workout in every day, and more about how can I make sure that I am moving frequently throughout the day? So in other words, they've literally done research studies that I'm sure you've heard of, where they took one group of people and they had them do a desk job, like 7 hours at a computer. And then at the end of the day, they had them do like a 1 hour workout on a treadmill.
Mm.
And then they measured beforehand, like different things, blood pressure, blood sugar, things like that, general health assessment. And then they took a second group of people and they had them also do a 7 hour day at the computer. But every 45 minutes or 60 minutes or so, they got up and did about 5 to 10 minutes on the treadmill. And at the end of the day, they had done the same actual amount of work as the people doing a 1 hour treadmill workout. Theirs was just interspersed throughout the day. And they did better on every parameter that they measured. So the point is, exercise is good for you for sure, but sitting for long periods of time without moving is inherently bad as well, like on top of things. So it's not only about making sure you exercise every day, it's also about making sure you don't sit for too long without moving your body. So that's the most general piece of advice I give. There is some research looking at like specific approaches to exercise that have been shown to possibly help plaque shrink or reduce the progression of plaque, more like what you'd call high intensity interval training, that I will sometimes, depending on the person, recommend incorporating also. But in general, it's especially mostly about moving, and just moving often, especially in ways you enjoy anyways, that you're not like, oh God, I got to go do my exercise again today or whatever, as much as possible. And then always, if you can do it outside, even better.
It's like Dr. Dean Ornish says, find something you do and you like and do it more
Yeah,
often.
absolutely. That's the bottom line.
Great. I have a question in the chat box about thyroid and Hashimoto, if it's possible that these conditions influence LDL levels.
Absolutely. Well, if they're not treated, yes. So like if you have insufficient thyroid hormone levels in your body, you'll typically have a potential for a combination of higher LDL levels and poorer functioning HDL. So it's a big deal. It's definitely important to be aware of. I screen everybody that I see for thyroid issues, at least generally. So yeah, it can have a big impact.
Okay. But have you, because I've had in my practice the case, have you had people where you noticed they reversed their thyroid insufficiency through plant-based diet?
I have seen that. Yep. At least to some extent. I mean, obviously there's individual cases. Some are going to be more stubborn, but so I would never say everybody with Hashimoto's can be treated with a plant-based diet, but I've definitely seen it improve, and even to the point where antibody levels go to normal. At the same time, I would also say that I've seen a few people on a very dedicated plant-based diet who were not making any particular effort to make sure that they were consuming iodine, have slightly low iodine levels and then slightly elevated TSH levels or signs of mild hypothyroidism. So I do also at the same time recommend people on that diet make sure they're getting enough iodine in.
Right. Okay. What would be the recommendation you would do on this aspect?
For most people, I generally just recommend a low dose multivitamin that has recommended daily allowance of iodine in it. I mean, if somebody doesn't want to take a multivitamin, that's fine. I just then would typically, if they're eating a fully plant-based diet, they have to make sure they're eating enough seaweed-based products. But at the same time, there's some variation in how much iodine is going to be in one batch compared to a next. So you can't necessarily exactly depend on what's on the label of a seaweed product, or dulse flakes or something like that, or nori sheets or something like that. So my bottom line is always test and don't guess. So just make sure their thyroid levels look good and whatever they're doing. Sometimes I'll go so far as to check iodine levels, but it's not terribly accurate necessarily. So I just try to. It's one of these things that I tend to err on the side of caution and just make sure that they're getting enough, and it doesn't take much.
Yeah. Thank you. I'm just going to have a look in the chat if I can see other questions, but I guess we've handled pretty much everything. Okay, so I'm gonna use the couple of minutes left to give the audience the chance to ask question loud if they want. So, falls ihr Fragen habt, die ihr noch stellen wollt, die nicht in den Chat geantwortet wurden in Bezug auf Cholesterin und Herzgesundheit, könnt ihr das Mikrofon laut machen und die einfach mal auf Deutsch stellen und ich würde sie übersetzen. We'll just give them a couple of minutes to react if they have questions, but I guess we covered already lots of subject. Thank you very much. Yes, so nothing is coming. No one is taking the mic. So I guess we did a pretty good job, or you did a pretty good job. Thank you very much.
My pleasure. Yeah.
If anybody wants to know more about you and eventually want to work with you, are you offering sessions online?
Yeah, I do. Most of my work these days is via video consultations. So I definitely work with people around the world to some degree, mostly in the U.S., but definitely a few people here and there. So happy to do that. My website's simple. It's just vital, VITAL human, HUMAN.com.
Cool. Thank you. So that's said for everybody who has interest to work with you. I was super, super happy and thankful to be able to have you here for this hour. And I'm sure lots of my clients enjoyed it because lots of them are here tonight. And I would like to wish you a beautiful day because it's
just getting started here. It's
okay.
11
cool.
11 in the morning.
So have a beautiful day. Thank you so much again, and we see each other very certainly another time.
My pleasure. Thanks for having me.
Bye.
Bye-bye.